For our speaker, and our speaker this evening is Trisha Rennie of Cautionary College. She's going to speak to us on prostate cancer and exercise. A little background on Trisha. An exercise physiologist and member of the Canadian Society for Exercise Physiology. Trisha attained a bachelor's degree in athletic and exercise therapy from Cautionary College, and also holds certification as a certified athletic therapist. She has worked with colorectal and prostate cancer survivors through the BC Cancer Agency and Victoria Exercise and Rehabilitation Centre, where she currently practices in a small interdisciplinary clinic. Based on current scientific and clinical practice standards, Trisha uses both manual and exercise therapy techniques to treat her clients. When she is not in the clinic, you may find her on the trails, hiking, cycling, or snowboarding. So let us welcome prostate cancer and exercise, Trisha Rennie.
Hopefully everyone can hear me at the back there. So excellent, good. It's great to see everyone here this evening. It's really been a pleasure of being a part of this group, and even more so tonight. It's just a really great place to be. So I'm honored to be here tonight to share my passion with you, which is using, as the topic states there, really using exercise as a treatment modality. So using exercise to help the healing process in whichever way that would mean for you. So again, thank you. I'm just going to grab my notes here. So just to give me an idea, I am familiar with some of you in the room who are currently attending the exercise program, but just to give me an idea, how many of you currently right now are within treatment for prostate cancer? Good, so we're going to keep our hands up, keep your hands up if you can. Tonight will be a practical and theory presentation, so don't be afraid, don't be shy to get up and move around as well. So within those of you who did put up your hands, how many of you would have received advice on exercise either during your treatment process or after your treatment process when you were looking to kind of get back to your normal everyday life, either from your doctor or your oncologist? Okay, so drastically the numbers have reduced. So really that's where my interest lies, and is sort of bridging that gap between your initial doctor visits or your follow-up visits with your physician or the oncologist, whoever that healthcare provider would be for you. And then in your return to your normal everyday activities. So whether that be just back on your walking program, whether you're returning to maybe a physical job, or maybe just your normal everyday Sunday golfing with your friends, whatever that may be, trying to ease that transition. So hopefully tonight we'll learn some more information on that. Get the right buttons here. There we go. All right, so a little bit of a background. For any of you who've attended the past presentations on exercise and prostate cancer, or maybe if you've just picked up a newspaper recently or caught a TV program, really what we're finding is the evidence is stacking up for the incorporating regular physical activity into our everyday routine. So we're really starting to understand the benefit that poses for us. Of particular interest to you really is the benefits of incorporating regular physical activity and how that can translate for yourself as a prostate cancer survivor. So there is more and more research being done every day. Sometimes I feel like we're bombarded really with all the things we are knowing that we're supposed to be doing. So hopefully tonight we can break that down into some practical tools that you can use. So like I did mention, tonight will be a little bit of theory, but also a little bit of movement as well. So please don't be shy, like I mentioned, to get out of your seat and move. We will go through a few things together. So not to alarm you. They will be fairly simple and easy to follow. overview here. So we will touch on the importance of movement. We will run through a couple of definitions just so that we're all on the same page. And we're going to go through some exercise guidelines. So what does a prescription for exercise look like for you? And it can be different for each one of us. Hopefully tonight you'll leave with some tools on how to get started with an exercise program. And then I do want to bring to light, like I mentioned, the current exercise program that's been up and running since June last year. All right, so to lead here, in the words of Dr. Robert Butler, so he's the former director of the National Institute of Aging. And one of the quotes that he said was, if exercise could be packed into a pill, it really would be the single most widely prescribed and beneficial medicine in the nation. So what we take from that and what we know from that is really two things. One, that exercise really, unfortunately, cannot be packed into a pill that we take daily. And two, that if it could, our prescription, like I mentioned, would be different for each and every one of us depending on where we are within our treatment cycle, maybe what other health conditions that we currently have. So unfortunately, as easy as it would be to have it packed into a pill, it's not. So what brings to light from that then is a lot of confusion. So there's certainly no shortage of email sites or information on exercise. Unfortunately, a lot of it is just sort of hearsay evidence and not really sort of peer-reviewed and quality resources that we can use. And on the flip end too, a lot of times really who we're taking our advice from is the physicians. And unfortunately, they're just really not up on, for the most part, they're not up on the specifics of prescribing you a safe and effective exercise program. They might give you something general to start with, but again, the prescription really would be different for each and every one of us. So just touching on the importance of movement, we've really taken movement out of our everyday lifestyles as the years have gone by. We've really engineered movement out. We get up in the morning, we jump in our car, we drive to work. Once we get to work, we're sitting typically at an office job now in front of one of these, in front of a computer. The end of the workday comes, it's 4 o'clock. What do? We jump in our car, it's dinner time, we drive to the grocery store. So instead of walking to the store to grab our milk, we're now driving. We're going to grab a buggy, put everything in the grocery cart rather than picking it up and carrying it. And then we walk out to our cars. We've got automatic doors to open up the trunk, the door, and everything. So we're no longer lifting, we're no longer bending, we're no longer getting that quality movement into our everyday activities like we once were. So it's important that we do look at that. So again, it sort of begs us to ask the question, and I've put it up here, is really we're sort of reaching a point where not prescribing physical activity may be considered patient neglect, and that sort of puts a negative spin on things, but again, I just want to stress the importance of that. And in further, there's a huge global health initiative out right now that some of you may be aware of, and that's Exercise is Medicine Canada. So it's a continuation of something that started in the States, which is Exercise is Medicine, if you're looking that up. And Canada has followed suit. So the goal, really the overall reaching goal with that is to have more healthcare practitioners that are knowledgeable in prescribing exercise, so in prescribing safe and effective exercise. So not only just exercise professionals like myself, who have a really small niche in the healthcare field, but also nurses, your physician, your oncologist, so bringing them up to speed on the latest research. So we're getting there. A quick little graph here. I didn't want to spend too much time on the research end, but hopefully you can see that essentially what it outlines through the chart there is just the relative risks of mortality or death from any cause with people with different risk factors. So maybe they have cancer, maybe they have heart disease or hypertension, maybe they have COPD. What this graph shows, if you take someone, say for example, with cancer or with heart disease, and then you compare that to an individual who also has been diagnosed with that same condition, but they're active. So again, you're comparing one who's inactive with a health condition versus someone who has that same health condition who is active. And what we see there, so within the darker graph or the red graph here, is that the active person has a lower risk of mortality or death, regardless of which health condition that is. The other thing that we know as well is that, or we're starting to learn really in the last few years, is that when we increase our activity level, so that's at any time point within our diagnosis, before our diagnosis, or after, we show an equal total and cancer-specific risk of death. We show a decline, which is great news. So again, at any time point during your diagnosis. On the flip end, I don't know if you can read the words there, but again, at any time point when we decrease our physical activity levels, so say, for example, we were quite active at one point in time, and then we had this diagnosis, the fatigue has really started to take a toll on us, and we stop being active, then our risk of cancer-specific death or our mortality does increase. So what I'm trying to get at, which a long-winded way of saying it, is that really being physically active at any age can really make a difference. In the clinic this morning, I had my oldest client that I've ever had at 96. And I knew when he sat down that it was going to come up that he was really old, you know. And it was really quite cute, but we got him really up and running in a short period of time, and I'm hoping to see him again in about 4 to 6 weeks after he's taken some of the exercises home and worked on them and worked on his balance and his strength. So really, it's never too late at any age. Even though sometimes you may think, I'm too old to start this now, you're really not, unfortunately, so you don't have that way out. I wasn't going to include this slide in because I had a bit of difficulty in narrowing tonight's fields down, but someone sent me a quick email, a fellow from the exercise class, and he said, Trisha, you know, you spend so much time in teaching us these exercises, but we really need to know what is the benefit, why are we doing these things, what benefit are these movements to us? So I've included this slide in. And really what the research is showing us, specifically with cancer and exercise, that when we do participate in a regular physical activity program, not only are we going to see changes in our body composition or our body weight, but certainly we'll see other health profiles improve as well. So whether it's our cardiovascular health, so having a stronger heart, our muscles will get stronger, our flexibility will improve, so we'll start to be a little less stiff, a little bit more mobile. Improvements, like I mentioned, in strength, and also psychological well-being, and that's a huge one. Oftentimes we term this quality of life, and really what it relates to is just our general well-being and our general happiness. So when we are moving regularly, we do have less risk of depression. And, really for a lot of us, that's a big thing. If we're just generally feeling happier, and then in turn we're also improving our overall health, that's an added bonus. For those of you who may be, those of you who did raise your hands, if you've undergone or maybe you're currently undergoing ADT therapy or hormone therapy, really what we're finding with strength training or resistance training, so we'll kind of get into that a little bit later, but when you're really sort of working on your muscular strength, that does increase testosterone levels. So we know with ADT, all the detrimental side effects of low testosterone, the symptoms that you do feel after treatments. Really what we find with strength training is that we're increasing testosterone levels. So we can help to mitigate some of those losses in strength. We can help to keep some of that bone density strong. So it's good things to keep in mind. And the other part as well is this is all without any adverse clinical outcomes. So again, if you've got a safe and effective exercise program, there's no other side effects that we typically see with other medications. So there is a quick video I do want to show you, if I can access it. Maybe we'll go and show and see if that works. So this is a exercise study that's still currently within the research stage. So it's out of the UK. Dr. Liam Burke, I believe, is the lead researcher. And they're looking at aerobic activities. So for example, walking, cycling, swimming, and the effect of that medium on PSA levels.
We all know keeping fit boosts your chance of living longer, but can it have impact even with a cancer diagnosis? A Cancer Research UK funded study is recruiting men diagnosed with prostate cancer to see if exercise can keep their cancer in check.
I was diagnosed with early stage prostate cancer, and my lifestyle was very sedentary. The very idea of the gym was repulsive. But actually, now that I'm part of that fraternity, I love it.
In this trial, we're trying to work out if we can deliver aerobic exercise training to a novel primary therapy for men with localized prostate cancer. When the men are with us during supervised exercise sessions, we track their heart rate using heart rate monitors. And they also track their own heart rate when they're doing sessions away from us independently. We're interested to see eventually whether exercise training has an impact on something called prostate-specific antigen.
Prostate-specific antigen, or PSA, is a protein produced by cells of the prostate gland, and PSA level, which is measured in blood, can help show if prostate cancer is growing.
It's early days yet, but the data that we do have suggests that exercise might actually be beneficial in terms of helping regulate the way that cancer cells grow and repair DNA.
Through doing this exercise, my PSA, which has been going up sort of alarmingly for a while, has suddenly come down again. I don't know what it actually means to have PSA levels reduced on a regular basis, but I know it's what we do.
If we do find out that exercise training is beneficial in terms of helping to control prostate cancer progression in its first phases, then it might be that fewer men actually progress and advance to stage of cancer where they have a much more invasive treatment such as surgery, radiotherapy, or even hormone therapy. And the idea that exercise training might help control prostate cancer progression also with much fewer side effects is something that's really exciting for patients, and maybe something that the NHS can offer as a treatment if we find it's beneficial later on.
Yeah, so it'll be neat to see the final results of that study there. Have some of you seen that video clip already? No, okay.
Sorry, Trisha, I'm going to throw out my critique of that, Chris.
Sure.
I
Have got her qualifications at University of New South Wales and is an accredited exercise physiologist. She's done many jobs in research and in hands-on roles, and she tells me she's very good.
Go ahead there, Alan. Yeah.
My critique is that is pre-surgery, and there is in North America debate as to the validity of PSA before surgery. There's arguments that down south of the border, PSA is being used too often as a criteria for surgery quickly,
Yeah.
but it should not be. In Canada, it's less so.
Yeah.
The key difference is that after surgery, PSA is a much more critical variable than it is before surgery.
Yes.
He's
yeah.
talking pre-surgery.
Great. Yeah. So yeah, that's a good point to bring up there too. So yeah, like I said, it'll be interesting to see some of the results, and I don't know when the proposed end date is for that one, so I'll have to look that one up. But what they were chatting about in the video is something that we call aerobic exercise. So for some of us who may be familiar with that term, if you're not, really when we talk about aerobic exercise, what we're referring to, for example, is activities such as walking, cycling, so riding our bike, whether that be stationary or outside, swimming, jogging, those sorts of ideas. So it's a low load, but a continuous movement that we're doing for at least 10 minutes at a time. So getting into some specific guidelines for yourselves or for prostate cancer, really what the research tells us is that we need at least a minimum of 150 minutes a week of moderate intensity aerobic exercise. So if we look at breaking down 150 minutes, initially that seems like, wow, that's a lot of time. But if we look at breaking that down over a five-day week, it would be about 30 minutes a day over the course of 5 days. If initially, especially if you're within treatment right now, if initially that seems, wow, 30 minutes, it's not that I don't want to, it's that I don't physically feel like I can exercise for that long. That's perfectly fine. What we do know is that we can work up to that 30 minutes in 10-minute intervals. So for example, what that would look like, you would go out, say for 2 or 3 minutes as a warm-up, so as a low intensity, and then for 10 minutes, you get the arms moving quite strongly, the legs moving quite strongly, and trying to get that heart rate elevated for at least 10 minutes. If you did a 10-minute interval, you would just repeat that about 15 times during the week, and then you would have your 150 minutes meeting our guidelines. So hopefully that makes sense to most of you, but we'll kind of touch on that again further. Again, it is important to have a warm-up and a cool-down within that. So what we don't want to see is going out, say, for a quick 10-minute jog, and then coming home and just parking and having all the blood pool in our legs. So we don't want to see that. We want to make it easier on our heart by having a gradual incline into the movement and then a gradual decline as well. So whether that's even just a minimum of 3 to 5 minutes as a warm-up and cool-down. And like I mentioned, that can be done in 10-minute bouts or more. The other point to mention too, for those of you who may not be going through prostate cancer, because it does look like there's some partners and support networks in the room, these are Canada's guidelines as well. So Canada really is in the forefront of the physical activity guidelines, which is great. Sometimes we're following suit of other countries, but with the guidelines, we really are forward thinking on that end. So again, even for general day-to-day people like myself, really the minimum benefits 150 minutes per week or about an hour and a half. What they do touch on as well with the guidelines is something I mentioned earlier, which is called resistance training, strength training, weight training, all being in and of the same term. So muscle strengthening within those guidelines is really just as important for you as the aerobic guidelines. So when we talk about strength training and how much of that you should be doing, it's to a lesser intensity and a lesser level than, say, for example, an aerobic program. So when we're strength training, we're really aiming for a minimum of 2 days per week. And when you're looking at how many exercises to include, we try to get ones for all of the major muscle groups in our bodies. So we try to do a minimum of 8 exercises and up to 10. Within that, so say for example, you were going to pick up a weight and move that 10 times. So that would be what we call 10 repetitions or 1 set. And again, this would be a minimum or an introductory level, especially if you're new to movement. So we would do this resistance training, like I mentioned, minimum of twice a week for just general health benefits. Of course, if you're wanting to get into bodybuilding or really try to get some solid, strong, very strong strength up, then of course we're going to have to do more than 2 days a week. But as a starting point, 2 days a week is great. So don't discourage yourself in thinking that, oh, really to gain any strength I have to go to the gym for 2 hours, every night. We really don't need that much. So again, pick 8 to 10 different exercises, so one for all the major muscle groups of the body, and work on that 2 days out of the week. So it can be as simple as half an hour to about a 45-minute program. The other thing that's important to note too is within the strength guidelines is balance training. So actually working on specific exercise that will improve your balance, and we will try a couple of those later. So to touch on a couple of definitions in hopes that I haven't confused you, when we talk about physical activity, we talk about, what I talk about is just general movement throughout the day. When we talk about exercise, we're talking about purposeful physical activity or purposeful movement. So exercise really is that time that we set aside that has a goal attached to it. So it's intentional movement. So you're going out for, again, at least 10 minutes at a time point. On the flip end, physical activity might be, for example, washing the dishes or doing the laundry or doing something around town. So where you're active, but you're not actually trying to increase a specific health profile such as your strength or your aerobic physical attributes. You'll see on the graph there as well, hopefully you can see that, it says 150 minutes of moderate to vigorous physical activity. So those, it gives you an idea of where our guidelines fit into there. Again, like I mentioned, those are for health benefits. So for most of us that just, we want to do what we need to do to be healthy, that's what we're aiming for. If you were to come up to me and say, Trisha, I really want to run the Times Colonus 10K, and not only do I want to run the Times Colonus 10K, I want to do it in 55 minutes. Well, then of course we're going to have to do some specific running or specific training in that domain. And at that point, we'd be working more on our fitness rather than just our general health profile. So for most of us in here, even myself included, majority of the time we fall under that 150 minutes per week. So just trying to be healthy and feel good. There's a bit of a pyramid here, again, just as a visual. So down at the bottom, in the yellow there, that's what we call, again, our physical activity or our everyday movement. So again, for example, cutting the lawn, doing the dishes, these all sound like chores, but they're just coming to mind right now. It could be just, taking the dog out, to go to the washroom, that sort of idea. So just general movements that we do throughout the day, parking our car farther away to get some more steps in. That's what we want to really have the majority of during our everyday. When we've touched on the guidelines, that's in our second box there. So 3 to 5 times a week, or working up to 5 times a week of that 30-minute interval. So again, that's our brisk walking, our cycling, maybe it's a recreational soccer team or a recreational hockey team that you're involved in. So that's where that fits in. So again, we still need it, there's no doubt about it, but we need a little bit less of it as compared to our general movement. On the top of our aerobic planned exercise, 2 to 3 times a week, again, that's our strength training. So we still need that as well, but not as often as we need the other movements. And then at the very top, there's a little note on cutting down on our sedentary activities. So they're really saying now that sitting is the slow death, or sitting is the new smoking. And really trying to cut down on watching TV, playing video games. For the most part, it's the generations that are up and coming that are really, really focusing on here because of the technology that's, again, in our environment. So just to touch on, if you do have a sedentary job, I don't mean to scare you at all, but just, again, trying to be mindful of incorporating movement into your workday. So how hard do you have to work? work? This is always a tough question. The easiest way to answer it is something that we review, and it's called the talk test. So it's a very simple measure of monitoring exercise intensity. So what the talk test is, essentially, it's 3 different levels. So when we talk about low intensity activity, moderate intensity activity, and vigorous intensity activity. So those are our 3 different levels. How do we know we're working in those levels? So now comes in the talk test. If you are able to sing, so well or not well is beside the point, but if you are able to sing, you are working at a light intensity. If you are able to carry on a conversation, you certainly can't sing, your breathing's a little bit more labored, but again, like I mentioned, you could still carry on a conversation if you had to. You would be in that moderate intensity activity, which is again where we're aiming for within those guidelines. Our last one, our third one, is the vigorous intensity. So if you're working out very aggressively or quite strongly, and you're really, if someone was to come up to you and strike up a conversation, you really aren't able to say much other than, yes or no sort of answers, then you would know that you're working at a high intensity. So for those of you, when I'm coming around to your exercises, during the Monday, Thursdays, and I'm trying to chat with you, really, I'm trying to see what intensity level that you're working at. So there's a method to the madness. I had a client last year, and I explained the talk test to her, and I thought, oh, great, she really understands this. And she had her normal walking routine from her home down into Oak Bay and back again. And she said, well, Trisha, she said, I'm walking, I'm doing my walking program, which is what you told me to do. But everyone, is looking at me. They think I'm crazy because I'm singing. And I said, well, Joan, if you're singing, you're really not working hard enough. So again, it's something simple to keep in mind. Again, if you're looking at starting a program, it's something simple that you can use. So the
when you hear
test.
McFarland singing, keep right on to the end of the road,
Yes.
you know there's trouble.
Yes, yeah.
Keep right on to the yes.
So now that we know what we need to do, how do we get motivated in starting? So this is really the big one. And if you ask me, the hardest part of anything, whether it's work-related or physical activity-related, is getting started. Once we're in motion, we have a tendency to stay in motion. So really what you want to do is have an idea of where you're going. What is it that you really are trying to accomplish? And we're going to go over some goal setting. I've got a little activity in there. Another thing that's helpful as well is having your gym bag ready. So whether it's in the car or maybe it's on your kitchen counter when you get home. I know certainly if I don't leave mine in the car, now that I'm driving instead of commuting by bike, then I see the couch, and if I sit on the couch, there's no way I'm getting up off the couch just to do some exercise. So having it close to you or nearby, there's a greater likelihood that you're gonna put your running shoes on. The other important thing too is to keep it fun. So if there's an activity that you enjoy, 9 times out of 10, we have a greater likelihood of sticking to that one. So keeping that one in mind, it doesn't all have to be serious. We can have some fun with it too. Making it convenient, if you have to drive 45 minutes across town just to get to the gym or to a class, really that's 45 minutes of movement time that's kind of gone out the window. So that doesn't make a lot of sense for most of us. Keeping it simple, again, touching on the fact that if we're trying to build some strength, we really, at minimum, we need 2 days a week. We don't need 5 days a week at 2 hours in the gym. So keeping it simple. And then the other part for building motivation as well is consider joining a group, getting a buddy to tag along. The days that you don't feel like doing it, hopefully that they do and they can encourage you out the door. So a little bit of activity just to keep you awake as we approach 8 o'clock. And again, I won't ask you to write this down. Don't worry about getting a pen and paper out. But perhaps when you're driving home tonight or maybe tomorrow morning when you're getting up and thinking of yesterday's events, I just ask two things of you. So one is, what activities do you enjoy? What do you really love to do? So maybe, again, it's cycling, maybe it's golfing, whatever is meaningful for you. So what activities do you love to do? It may even just be one, and one's okay. And then the second question, and this is a task-oriented goal, again, exercise presentation, so exercise related. What is something that you've always wanted to do? So, for example, maybe it's, well, I really always wanted to do a cartwheel, or I really always wanted to do a handstand. Maybe it's, I've always wanted to play with my grandchildren without having back pain. So it's a task-oriented goal is the second one. So again, first one, what is something, an activity that you love to do? And then the second one, what is a task that you've always wanted to be able to do? So what's something that you've always wanted to be able to do and maybe haven't, or maybe you just haven't in a few years. So just something to think about there. And I would love to hear your responses. So I think my name and email is floating around somewhere. So if you're on the internet, I would love to hear what's important to you. So now that we're up and running, we've joined a gym, or maybe we've joined the exercise program that's already up and running, or maybe we're just, I mean, it's lighter out later, it's a little bit easier to walk in the evenings after dinner. So we're up and running, we've got a solid 4 or 6 weeks in, and then we get sick or something comes up and things start to regress again. So how do we stay motivated? Again, when we talk about the goal setting and really having a vision of where we want to go, don't be afraid to write some of those goals down. So there's no harm in doing that. Stick them on the fridge so it's that daily constant reminder. Or tell your friends and family what that goal is for you. With the other note of writing it down, my memory is not great at the best of times. So I forget what I actually started with 4 weeks ago. You know, so if you're into, say, week 5, you're like, wow, this is still really hard, and you look back at what you started on week 1, and it was the 5-pound dumbbell, and now you've moved up to 8 or 10. There's a lot of motivation that comes with that, in knowing and tracking your progress. The other note there as well is consider using technology. So there's some great accelerometers and pedometers out. There's the Fitbit bands. There really is so many apps. I couldn't even name them all or really tell you how they all work, but I could help you try to figure it out if you were keen. And really, even for example, say something like counting our steps. When we do keep track of that, or when we do count them, typically we increase our steps by about 2,000 to 2,500 per day. So again, it's something just to keep in mind to help you stay motivated. You know, you look at it and you go, wow, I was really aiming for 10,000 steps and I've only got 2,000 today, so maybe I'm going to head out for a walk. Again, the note there on the buddy system or building a social support network, so let others know perhaps they want to be involved too. Rewards, that's another thing that may work for you. Doesn't always have to be food related. My rewards typically are food related. But find out what motivates you. Perhaps after 4 weeks you're going to buy yourself a new pair of running shoes if you've stuck to your program. So rewards may work, the whole idea of a carrot and a stick. Again, plan for setbacks. So if you set out your week, say Mondays and Thursdays, you do your strength training. Thursdays you're not able to do your usual routine for whatever reason. Have another day during the week that if something comes up, you're able to fall back on it and still get your exercises in. So maybe it's Saturday morning. It's not the best time of day for you, but it's a time that you could get your exercises done if, say, for example, you missed Thursday. And the other note there is just on self-efficacy, so really believing in yourself that you can get started and do something. Again, that idea of it's never too late to start. So here's a couple of things as exercise professionals that we think of or things to keep in mind Again, when it comes to the prescription and how that varies for each and every one of us. So say, for example, again, you've undergone ADT therapy. We know from the loss of testosterone that that does have a negative impact on our bone health or our bone strength. So we're at higher risk for fall and fractures. With that, what we would look at incorporating into your routine is muscle building activities. So say, for example, strength training, so that we've touched on there. So really, if you've undergone that form of treatment, really, in addition to walking, you'd really want to focus on your strength training. And for you, that may be more than 2 days a week, once you get up and running and get started. And then, of course, the cautionary note on the fall and fracture risk there. Perhaps you've had a radical prostatectomy or surgery. With that, of course, the one that we typically read all about is the Kegel exercises. So certainly pre and post-surgery really can have a positive effect on any urinary disruptions. So if you're diligent with some of those movements, you can see a positive effect on that. Chemo or radiation. So the big thing to keep in mind with this one, some of the chemotherapy protocols can result in a numbness or a tingling in our hands and our feet, what we call a peripheral neuropathy. So for that one, we would want to be careful with balance training. I would say that we would certainly want to add balance training in, but again, there's the cautionary note if you do have a lack of sensation in the feet, that doing the balance training at home by yourself might not be the best plan. So really having a group to do that type of movement in, and again in a safe environment. As well with the chemotherapy and radiation, you may find that sort of at your third or fourth treatment cycle, the fatigue really starts to set in. So just being mindful that you may need to make changes during your exercise program because of that. The other note I have in there as well is about avoiding public facilities. So sometimes with the chemotherapy and radiation protocols, we can see a decrease in our immune function, so our body's ability to fight infection. So with public facilities, if you are exercising in a gym, just being mindful, it's the simple things of washing our hands, and really talking to your doctor or your oncologist about your immune function and if it is safe for you. So just being something to be aware of. A quick note on fatigue. I won't spend too much time on this slide, other than what we've been finding out, that exercise can help with this as well. So really a solid walking program, even though with fatigue, of course, you might not feel like walking, it's really the best thing that you can do. So some special considerations. If you are one who is currently within treatment, I would encourage you to chat with your oncologist or your doctor about starting an exercise program, especially if it's brand new. So again, from some of the points that we've mentioned, it's always a good idea just to double check. Allowing for those down days in your treatment cycle. So again, if you're under a radiation type of protocol, like I mentioned before, you may experience the most fatigue at the end of those cycles. So just being mindful of that. And what I've already touched on with the public health facilities, washing the hands, that sort of idea. Some of the things to think of, and this is typically common sense, but it is good to note, when you would want to stop exercise. So if you're having sudden shortness of breath, chest pains, things that are really unusual. So even bone pain where you really didn't do anything to that knee, you don't have a previous injury to that knee, but all of a sudden it's really starting to ache and be quite painful and sore. Those are some times when you would really want to stop what you're doing and then contact your physician. So just being mindful of those as well. Again, like I said, for the most time, pretty common sense, but sometimes the idea of no pain, no gain does still find its way. Again, some other precautions. So anemia can be, or really a low red blood cell count, that can be a result or a side effect of treatment. And with that, it's important to keep in mind what our red blood cells do is they carry oxygen to our tissues. So if we have less of those cells, less of those red blood cells, our tissues aren't getting the oxygen that they require, or maybe not as much as they require. So again, just being mindful of the exercise intensity and finding an appropriate level for you. Same thing like I mentioned with the low white blood cell count, you can find out these numbers from your doctor, but we touched on that one. A low platelet count, so you might find that you're bruising or sort of bruising or having redness more easily on the skin, so that could be a reason why. And some other precautionary measures when it comes to exercise, any extreme sort of nausea, diarrhea, those sorts of ideas. You would just want to go careful with starting an exercise program or starting sort of movement back in your treatment cycle. And some other symptoms there as well. So I realized I'd made some photocopies of some exercises, but if I was thinking ahead, I would have attached them to your pamphlet that you already have. So if you are keen, which I hope you are by tonight, on starting some exercises at home, I have listed 5 of mine, and this was really, really the hardest part of the presentation, was just to pick 5. So if you're keen, I do have some take-home just at the outside of the door there. So you'll see a blue pamphlet, and then as well there's a pamphlet here. So if you're keen on trying some of these, there's ones that you can do at home to get started. So at this time, I would like to invite up my 3 volunteers. It's sort of neat that it's National Volunteer Week and I have volunteers. So if you would come up to the center stage, I'm going to put these 3 great gentlemen on the spotlight. These are 3 participants in our exercise class that I had the pleasure of really working with. I would say teaching, but really we have a lot of fun. So we're going to go through just 3 of these 5 movements just for time's sake. And again, like I mentioned, this comes into the practical part of the demonstration. Please don't be shy. Please feel free to get out of your seats. It will encourage your neighbor to get out of their seat. And we'll try some of these movements out together.
Excuse me, Trisha, what's dead bug exercise?
Yes, we're going to show you. Yes.
Put your swatter away.
Yes.
No bugs will be.
And like I said, it was really difficult to pick 5. You'll notice that the Kegel exercises aren't on here. And I had, I had a brief, I can't do a prostate and, cancer exercise topic without putting Kegels on. But really, we're pretty familiar with Kegel exercises. So if you want more information, I'm happy to share, but we'll go through some other ones which I hope that might be of benefit to you. So to try, we have 3. So again, if you want to stand up and get out of your seats. Finally, after all this talking, we can get up and move. So the 3 that we're going to go through, the first one is marching on the spot. The second one is a sit to stand, or what we call a squat, so an incredibly functional movement. And the third one is what we call a standing dead bug. So these gentlemen know these exercises very, very well, probably too well. They're tired of me explaining these ones. But as a group, what we're going to start with is just walking on the spot. So really trying to get our arms moving, trying to get our legs moving. There you go. You can try your singing test or your talking test if you like.
Let your heart be strong. Keep right on up ahead.
But this is a good example of one movement that we would do within our exercise session. So we do quite a bit of walking or marching on the spot. The key with this one here is the faster that you are walking, of course, the more intense of the movement that it is. So well done. We have mastered the marching on the spot. I hope there is no questions with that one. We had to start off like really, really easy. Again, again, on the self-efficacy part. The next one is the sit to stand. And because these gentlemen are so good, I haven't even provided them a chair up here. But this is our squat exercise. So the big thing with the squat exercise is it targets our lower body, and not just one muscle, but all the muscles in our lower body. Really the biggest thing as we age is we want to stay independent. We want to be able to get ourselves in and out of bed, on and off the toilet. And I've worked in enough long-term care homes to know how crucial that is. So hopefully with this one, again, if you have any discomfort, just leave this one out. But otherwise, again, we'll try this one as a group. So you want to start with your feet about hip distance width apart. So if you landmark your hips, your feet are coming straight out from that area. With this one here, you will have the chair as a guide. You're going to sit back just like you were going to sit in the chair, but you are not going to sit in the chair. You are going to stand right back up again. So if these volunteers here would like to show us how to do this one, and you can follow suit. So you're bending at the knees and bending at the hips, activating the lower legs to stand yourself back up again. A couple options with the hands. They can either be out in front for balance, if you do find that is a bit tricky. They could be overhead to increase the intensity of this exercise, or they could just be on your hips. So a really, really good functional movement.
Sound effects recorded.
If you were to hold this movement, so again as we bend down, if we were to hold this movement to 3, 4, 5, down, 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 3, 4, 5, or 6 seconds, again that's another way to increase the intensity of this exercise. So a really good, easy one that you can practice even at your workstation.
Is your back supposed to be vertical or can it bend?
Yes, good question. We want to just have a flat back. So whether that is vertical, so maybe Peter, if I get you to turn.
No, not me.
We'll put Tom on the spot. So Tom, if you want to face Ron. So as long as the back is flat, as you can see here.
Stay down, Tom.
That is the key. So it can be more vertical depending on the amount of extension you have in your mid-back, or you could be straight up and down. But the key is that you're having this nice long line all the way from the neck down towards the hips. Yeah, rather than being rounded. Yeah, good question. The last one is our standing dead bug. So this is a core and balance exercise all into one. Peter and I practiced this on Monday, so he's got a head start. It's like standing dead bug, what is this? So what we're going to do is stand on one foot to start with. We'll start with the easy version. So standing on one foot, the knee comes straight up. So straight up to 90 degrees, well, as much as the chair will allow you. From this position, what I want you to think of is engaging the abdomen. So tightening that area below the chest and above the pubic bone. So just allowing a bit of engagement there. From here, if that's still easy, you're going to raise your opposite hand overhead. So if you have your left knee up, you're going to raise your right arm up.
Good balance, Peter. Good balance.
So you have some great balance in the group. This is awesome. If that is still too easy, and again, you're being mindful of keeping this tummy muscle strong, you can try closing your eyes. As we see everybody tip over. So you would try to hold this movement from anywhere from 10, 15, 20, 30 seconds if you're an all-star and you've been working at this one. And you would do both sides. How many would you do of each? You would do 10 repetitions of each side, holding for that 10, 20, 30 seconds. Good, well done. You've impressed me so far, so this is great. Yeah. Thank you, thank you. Well done. And at last, the Kegel exercises. Like I said, I couldn't create a presentation for you without touching on the Kegel exercises. All I'll say is that they're not just for women after childbirth, so. All right, now on to the good stuff. You really do have a great facility here through the Island Prostate Centre. So it's with great thanks to Dan, Leanne, and Sean, who's not here tonight, that I'm even standing up here today. Really it was last June. Probably last May. We sat down and Leanne said, I really want to get an exercise program up and running for the group. We had no idea what it would transform into today. There's been about 25 different men and women who have partaken in the class at some point in time. We typically have at least 16 members who attend regularly each week. And even starting out, it was sort of funny because I wasn't sure what to expect on the first day. And we had 6 members come in right off the hop at 9 o'clock, and they were full of energy and really quite keen on getting moving. And the great news is that those 6 people are still involved in the program today, so it's really been great. So a little bit of details on the program itself. We're currently right now looking at an expansion plan, so that will be within the next couple months to come. But like I mentioned, it runs twice a week, so from 9:30 to about 10:30, 10:45, depending on what kind of activities that we get into for the day. And it's a circuit style of format. So what that is, I call it a 2-for-1 workout. We not only work on our strength, but we also work on our aerobic fitness. So we have about 8 to 10 different stations that we run through. We spend about a minute to a minute and a half, 2 minutes at each station. And like we mentioned earlier, we try to target all of those major muscle groups. So when we do that in a continuous fashion without having that rest break in between, which I think they would love some days and we don't always let them have, we keep our heart rate elevated. So in a way, we're working on our cardiovascular health, or our 150 minutes a week, as we're also working on our strength exercises. So again, circuit style of class. I didn't mention the location. So right now, the program is currently up and running at a church, First Metropolitan Church. So it's downtown on Quadra and Balmoral. Everyone is welcome to attend, including spouses. So we have about 5 spouses or so that attend regularly, and it is really great to have their support. So that is open and welcome for you as well. And like I mentioned, we do work on the strength, we do work on the flexibility. So we start out with about a 10 to 15 minute warm-up. We go through our exercise circuit, and then we finish with some cool down and stretching. So it's pretty all-inclusive that way. And then there is a little bit of paperwork, of course, always with these things there's paperwork. So when you do come to your first class, be prepared to answer some questions about your medical health history. So either your journey with prostate cancer or maybe other chronic health conditions that you may be experiencing. Yeah.
How long after surgery should you wait?
Good question. Yeah, so sometimes it is important to let the body heal after surgery. I would say if you're looking at coming to the exercise class, I would wait a minimum of 4 weeks. And certainly it would be advisable to chat with your oncologist about that. But it can be upwards of 8 weeks, So certainly it's not to say that you can't exercise during the meantime, but it might be for you, it might be looking at doing a lower intensity level program initially before joining the classes. We are looking at offering a beginner program specifically, so that might be in the works to come, like I mentioned, in the next couple of months. So with that, it may be shorter in that 3 or 4 week interval, depending on the surgery and if there's any complications. Yeah. Yes?
What sort of clothes do you wear?
Good question. Whatever is comfortable to move in. So the interesting thing, which I love with working with this age group, is you always look so professional all the time. So a lot of people you'll find working out in a collared shirt and dress pants. Whatever you're comfortable to move in. So it can be shorts and a t-shirt. Running shoes would be preferred. We do have weights within the circuit, so you want to have a closed-toed shoe. And like I said, we do spend a bit of time walking, marching, so having a comfortable footwear is key. Really the only things to bring to a first class, other than comfortable clothing and good footwear, is just a water bottle. So pretty simple on that end. Any other questions on the program? So,
Rennie, you said Quadra and what street?
Quadra and Balmoral.
Balmoral.
Oh,
Balmoral.
Balmoral. All right. For the past year, I've been saying the name wrong. Yeah, it's First
It's where the
Metropolitan.
Queen hangs out in the middle of summer.
Yes, yes. And again, like I mentioned, there is some pamphlets outside the door there, and if you are online, that it is on the Island Prostate Centre's website. So, or otherwise, you can get in touch with myself or Sean. Here's a quick little photo of some of the members of our group. So, really, it's thanks to their great attendance that we're still up and running. So, not everyone made it into this photo. Poor Hannah did not make it into this photo. But yeah, just to give you an idea, you might recognize some of those good-looking faces. Yeah. So just in summary, before I leave, before you venture on to the small groups, there's a quote from Aristotle that I absolutely love, and really it kind of comes down to making that habitual movement. So we really are what we repeatedly do. So trying to make those small everyday movements incorporate those into your everyday lifestyle. Just being active around the house just isn't always enough. So again, being mindful of the 150 minutes per week as those health-related guidelines and 2 days a week of strength training. Starting small. So really, when we start out small and move gradually, especially for those during treatment, you're going to have a lot more success and a greater ability to keep up with your program. Really, for us as exercise professionals, we want it to be safe. So if you are working with a group or perhaps joining in one of the classes at the rec center, safety really is our primary concern. So if we gently tell you to slow down or sort of critique your movements, it's not because we're picking on you, but it's because we want you to be safe and not injure yourself. And the last point there, which is I hope the point that I've been able to get across, is really that exercise, it truly is an integral part of the cancer recovery and the cancer care. So not only is it important to follow what your oncologist is recommending, but really it is important to have the movement in there as well, and that it's safe for you. Again, you might recognize some of those faces. Hopefully I've shared some good tips to you that you can use, but really all the secrets of success won't work unless you do. So really trying to show up for yourself and making movement a habit. So if you have any questions, like I mentioned, I'd love to hear from you, even your goals. As silly as you think that they may be. Again, this is sort of what interests me and makes me tick, so I would love to hear from you. And if you would like to reach out either to myself or Sean, so if you don't know him, he's the nurse at the Prostate Centre and a great resource as well. So again, feel free to contact either one of us. That's it for tonight, so thank you.
Thank you.